Okay guys, we've got a quick one today. This is going to be ICE syndrome. ICE stands for iridocorneal endothelial syndrome. This is a disease where the endothelium acts like epithelium. So it grows, it gets everywhere, and it starts clogging up the angle. This disease typically affects women in their 20s to 50s. So I've illustrated this by making our ICE queen a young woman. This disease is unilateral as opposed to Axenfeld Rieger, which has a lot of similar symptoms, and that is bilateral. This disease is unilateral. I've illustrated this by she has a scar over her right eye and it's missing, so she has one eye. This disease is sporadic inheritance, and my sketchy symbol for sporadic inheritance is surprise. So she has a look of surprise on her face. This is an opposite to Axenfeld Rieger, which is autosomal dominant. In this disease, the endothelium is not working well, and it has a characteristic appearance. It has a beaten bronze or hammered silver appearance. For my memory hook for this, I have a silver hammer that she's wielding with her magical ice powers. The type of glaucoma that ice causes is a secondary closed angle glaucoma because there's a lot of PAS that forms and it kind of glues the angle shut. This PAS is very high rising. It can go anterior to Schwabe's line. Conceptually, I think of this because the endothelium is damaged and it's not really preventing a healthy endothelium wouldn't let any PAS grow on it, but this is damaged, so it's letting the PAS grow very high. But as a memory hook, you can see that this ice queen is wearing a crown, and on these crowns are some very tall, pointed icicles, and that is supposed to remind you of the very, very high rising PAS that are growing across that angle, just like those icicles are across the headband of her crown. There are three main forms of ice syndrome. There's the subtype Chandler syndrome, the subtype Cogan-Reese, and the subtype essential iris atrophy. Chandler syndrome is the most common, and in this subtype, the corneal edema, corneal change is predominant. The dysfunctional endothelial cells aren't doing their job as good pumps and keeping the cornea clear, so you get an edematous cornea and it gets hazy. Corneal clouding is a big part of this subtype, and I've illustrated this by having these big angry-looking storm clouds above our ice queen. The second subtype is Cogan-Reese syndrome. This is where you get these little pedunculated nodules, little pigmented lesions on the surface of the iris. And the way that I've memory hooked that one is on our ice queen has a little fur trim on her gown, and it's speckled with these little dots, these little moles and freckles to represent Cogan-Reese. The third variant is essential iris atrophy, and in this variant, the iris atrophy feature of ice really is the most predominant feature. You get this severe progressive atrophy of the iris, you get all this correctopia, this hole formation, polychoria, atropia uveae. It can look very dramatic. I've illustrated this by having our ice queen's cloak kind of tattered. It's got these holes and tears, and it looks like it's seen better days, and that's to represent the essential iris atrophy variant of ice syndrome.